Hi, everybody. Good afternoon. This is Dr. Annette Mercatante from the St. Clair County Health Department. We're back to answer your questions from the St. Clair County Health Department. So let's get right to the data and get your questions. So this week, we have now a total of 22,500 cases, known cases, I like to add, and obviously 866 hospitalizations, 593 deaths, and the 20,000 plus known recoveries. What is significant this week, the change from last week, is the 17 new COVID deaths we have now had reported to us. Now, some of those deaths did not all occur this week. They've occurred over the last several weeks, but the death reporting is increasing, and that is typical after our COVID surges. We tend to see those later on in the course of the transmission. We're still at a 13.3% testing positivity, and we're still at a 60 plus average cases per day. Next slide. So this is our illustrious graph, and it's making us all really nervous. It looks like there might be a slight decrease there, but again, it's a little too early to say. And overall, I would say we still feel like we're in a solid plateau at this high transmission rate. Our data person is telling us that other counties do seem to be coming down, so we can only hope that we follow in their footsteps in the coming weeks or days. Next slide. And then our data information, we've included the light gray at the top is the booster doses. And you can see we're going fast and furious doses. We are still providing 2 to 300 first doses of COVID vaccine per week. And overall, our vaccination rates remain at 55.4%. So slowly coming up, but still really doing way more boosters, vaccinating those who've already been vaccinated. And what we really need to do to slow transmission is to get some of the unvaccinated vaccinated. So that's still our primary goal. Next slide. This is our breakthrough cases as far as hospitalizations and deaths. I didn't look at this. 53% of the population is fully vaccinated, but as I mentioned to you last week, it accounts for only 24 to 29% of all of our cases, hospitalizations, and deaths. So you have a significant reduction in both cases, hospitalizations, and deaths for our vaccinated individuals. Um, so, it's worth noting that as more people get vaccinated, we will see more vaccinated individuals become cases and get hospitalized. That's just the math. But vaccination effectiveness still appears to be very robust and worthwhile. So, next slide. And then this is our data dashboard. So I always love because I don't have to really dwell on this, but just go to our website, suck in that data. I know some of you guys are real data wonks, and you can go ahead and study it. And just remember a couple things when it comes to case reporting. It's really only as good as testing. We only report positive cases that come to us through the system because of positive testing. So anyone who's had COVID and either didn't get tested or the antigen tests get put in there eventually, don't they? As a probable case, but it's a little lagging behind. So cases can vary a little bit as well by areas that tend to get tested or not. Okay, so do we have any questions? Oh, I'm supposed to start.
Yep.
I'm sorry.
Let's talk about boosters first.
Boosters. Oh my gosh, you guys have so many questions about boosters. Just as we were thinking we weren't going to get more confusing, we got more confusing. So, as you all know, booster approvals have come through, and they are a little different for each product. However, I could just say this: anyone who's been fully vaccinated by any product, the mRNA vaccines or the J&J, and is 18 years and older, quite honestly, is eligible for a booster, as long as enough time has gone by since your final dose. Okay, so there are eligibility things like if you're over 65 and if you have chronic illnesses, or if you're in a high risk situation, work environment where you're likely to get exposed. Those are all reasons that would motivate you to get a booster more likely. But really, the bottom line is if you are over 18 and you've had a full dose, either a single dose of J&J or 2 doses of the mRNA vaccine, you can get a booster. Now, if it's you have to wait 6 months from your final dose of an mRNA vaccine to get your booster, and you only have to wait 2 months after your J&J dose to get a booster. And the booster can be any one of the products, so you can they call it mix and matching, but you can certainly get a Pfizer booster if you've had an mRNA or vice versa. Now, they are recommending if you've had a J&J vaccine that you should get a booster, and that's because the data would indicate the mRNA vaccines are a little more robust as far as the reduction in hospitalizations and severe illness. So that is a recommendation for a should. Some of the others are may get boosters. And if you're confused, go to our website. We've posted some nice algorithms there. Of course, you can always go to the CDC website and read through their very long and complicated clinical guidelines that I have to read 2 or 3 times myself. But that's really the long and short of boosters. We are scheduling booster appointments online. I think we're a week or two out for those appointments. You can also get these boosters at your pharmacies and at many of your healthcare providers' offices. So keep looking for those locations. Um, did I
Another
cover
thing
everything?
well, one other thing just that people can do, because it's actually more than a few weeks for us for appointments, is they can go and visit vaccines.gov, and you can put in your zip code, and it will tell you the nearest spot where you can get the vaccine.
Okay. They told me
There's
2 weeks today at this
Oh,
point,
they did?
but that's all
Oh,
right. Yeah.
okay. I
All
thought it
right.
was a little bit
So
longer. Okay.
all right, so that's
Do you want
still good. And I want to talk about the pediatric COVID vaccine. We should mention that too.
Yep.
We are perched and ready for shipment probably as soon as next week. The ACIP, I always forget what does the A stand for?
Advisory?
Anyways, yeah, Advisory Committee on Immunization Practices. This is the second independent advisory group. So the FDA weighed in last week, the VRPAC group, and now ACIP meets, I believe, on Tuesday, and they often provide the final guidelines for who gets the vaccine and how often, et cetera. That then gets sent to the CDC that issues guidance, and it's that written guidance that we write our standing orders from and allow those vaccines to actually get delivered into arms. With that said, the vaccine will be becoming available. It's going to be delivered to some of our pediatric offices as early as next week, and so you can start seeking out vaccine then. We will likewise be taking appointments for vaccine. And as you just heard, our appointments are scheduled a couple weeks out. So there actually probably won't be any pediatric vaccines given here in the health department next week unless we adjust our schedule. But we'll be rolling them out as quickly as we can. So that is how we're going to do that. Any
Okay.
questions about that? Jen, did
I
I
see.
follow that?
Yeah, you did.
All right.
There's some more on the live that I'll go through, but I want to
Okay.
just get to you. You kind of already could have answered these. These are questions from last night. Once the vaccine is approved for the 5 to 11-year age group, will it be available through the health department? If yes, will you be running any vaccine clinics? Do we call and schedule an appointment?
Did we just say that? Call and schedule an
Yeah,
appointment? All
yeah.
right.
But right now, we don't have any special vaccine clinics planned for this age
Oh,
group.
I see. That was the question. Yeah.
Right.
We do have a drive-through clinic, however, on next Saturday, November 6th, I believe, at the Wadhams Tri-Hospital EMS Center from 10 till 2, where COVID vaccine will be available as well as flu vaccine. Now, I don't believe they're going to have any pediatric formulation there,
I don't think
but
so.
it is like a drive-through clinic for you if you wanted to get your boosters there. So that's an option as
Yeah,
well.
that's a great option. Okay, the other question was, since Halloween is on Sunday, can you provide some guidance on celebrating Halloween safely this year?
Sure. Um, so first of all, talk with your kids about Halloween safety, not just about COVID safety, but crossing the street carefully and not getting hit by cars, and don't eating unwrapped candy and all the stuff that you talk to your kids about. Outdoor activity is always safer than indoor activity. That has not changed. So outdoor is always safer than indoor. Small groups are always safer than large groups. So if you can trick or treat in your own little pod where you know who the people are, that's always an advantage. Avoid congregating, obviously, in groups indoors around houses. And if you do go indoors, especially if it is a crowded setting where you really don't know people, it is prudent to use a face mask. And a costume mask is not a substitute for a cloth or surgical mask. So just keep that in mind. For homeowners, distribute your candy on a table to eliminate direct contact. I've seen some pretty nifty chutes and things people have set up so they don't have to do a lot of touching. Um, and then handing out candy in open spaces where distancing is possible. And of course, all of you guys remember hand washing, hand washing, hand washing. Have some hand sanitizer available, and use that frequently as multiple hands are reaching into things. So that's our Halloween safety,
All right.
and go
So
from
we'll
there.
get to some of the questions today is coming through. Okay, this is about Moderna booster, but Cindy asked, do you give the Moderna booster shots for over 65 years old yet?
Yes, yes. So Moderna and Pfizer, actually, all boosters are recommended for people over 65 because we know they're more vulnerable to serious infection. We also know that the older you are, the less robust your immune response is to vaccines. So yes, yes.
Okay. The other question came, well, Wendy had a comment. She said, you are so appreciated. So that's nice to hear. Kathy said she got her Moderna booster at Kroger, so that's good. Cindy says, thanks for all the info. Susie said she called today and she couldn't get in here till November 29th. So,
Ouch. All
yeah,
right.
so
All right. Well, we
we just
got some new
recommend,
staff starting up. We're gonna work on that. We can only do as much as we can do, but we'll keep fighting to shorten those wait times. I
and
apologize about
people,
that.
just like you said earlier, pharmacies have them as well. So
Right.
there's a lot of different options, or the drive-through clinic that you mentioned coming up. Okay, Heidi wants to know how many total active cases in St. Clair County right now? The chart says 444 new cases. Is that the total or just this week?
That's just this week. So I guess I don't know. Do we even have that? Do we adjust that number? How many? And of course, I'm just going to say this right now. Counting numbers when it comes to cases, both active cases, quarantined people, is an estimate. Because remember, we just there's no way we could possibly absolutely know with any accuracy how many cases there are, since a fair amount of people are asymptomatic, okay, which they may not even know to get tested. They're still infectious. And a fair number of people aren't going to get tested because they don't want to quarantine or isolate for 10 days or quarantine their close contacts. So, did you have a number? 1,356 is what we know of that are currently still active as far as active cases. Yeah. Yeah, and I'll just mention to say that this data game is we're constantly catching up and going back and redoing it. So that would be the number today, and if we went back at 4 o'clock tomorrow afternoon, it would likely be something a little different. But the thousands, I would say, and I'll just say this: I also think that's an underestimate. So I have seen literature suggest that for every case we are aware of, there are 3 or 4 cases that we are unaware of. Of course, there's a lot of variables for that, but I could easily say for every case we know of, there's at least 1 or 2 that we don't know of. So you can take that number and double it. So 2 to 3 thousand active cases at any given time in our community right now is a pretty decent estimate. Now think about that, what's your risk of having an active person in a building if you're in a room with 50, 60 people. It's pretty darn high. that there's somebody in there that has COVID and probably doesn't know it. Okay.
Okay, the next question is from Janine. She asks, she says, I just don't understand why the schools haven't paused yet. You have said the schools will if there's a problem. There's definitely a problem in them, especially Port Huron Northern.
Because each week we get the same kind of number of cases, they're not escalating. And I think we need to have some more discussions with the schools to see what they're doing. But the bottom line is because they are still able to function, right? In the previous times where schools have paused, is because they have had enough people out. Primarily staffing, to be honest with you, that made it really difficult for them to maintain their schooling in a valid way. So I suspect that right now, even though there's cases cropping up and there are kids that are getting exposed in the classroom, it's not to the point where it's shutting a classroom down or creating a functionality problem. Now, as a parent, what can you do? Mask your kid. All right. There's no reason your kid can't wear a mask when they go to school, and we'll continue to talk to the schools and encourage them to implement more mitigation strategies. It's a great question, and I don't have a really great answer other than we're just going to have to keep trying. Obviously, this surge, and I'll just say this: look how long this surge has gone on. Okay, what week are we in now at this high level? Week 8, 9. I mean, so think about this. If we had started to pause schools back when it first started and we were starting in trouble, we would now have our kids out of school for a matter of months. And we really have to weigh that risk with the benefit of what that would really do. So I'll just say there's a lot of things here to consider. And the sheer long lasting persistence of this surge has really become kind of more problematic. We have to think about ways of functioning amidst the transmission of this virus. So I'll stop there.
Okay, the next question is from Wendy. She asks, as far as Moderna, do you recommend full or half on the third dose?
Okay. There is a difference between a third dose and a booster dose. A third dose of an mRNA vaccine is what's given when a person is immunocompromised, because we don't think that the 2 doses a month apart are enough to give them that full primary series. And so there's a third dose that's recommended for those vaccines as part of the primary series. A booster dose is what's given 6 months after a primary series. All right. So if you have a completed primary series, whether it's 2 or 3 doses, depending on your underlying medical condition, you have to wait 6 months to get a booster dose. Now, in that situation, the booster dose of Moderna only is a half dose. The Pfizer dose is still a full dose, and the J&J dose is still a full dose. So that's where it gets a little confusing. But I do want to differentiate the fact that we are talking about 2 different things when we talk about a third dose, which is a full dose of mRNA, versus a booster dose, which would be a half a dose of the Moderna and a full dose of Pfizer. Are you thoroughly confused? Good.
Whoa,
Uh,
yeah, I
we're
am.
gonna put that algorithm on our website as well. So and let's face it, your healthcare providers should know this. And if you're not sure that they're going to know this, download that algorithm sheet and take it with you and make sure you're getting the right dose. But people who are providing you the vaccine are aware of these variations and will follow correctly, I'm sure. Which is why you want to wait till the full standing orders are written, okay? We don't need to rush this out. We want to make sure everyone's doing this right. Okay.
All right, the next question is from Janine again, a follow-up. She said, when will the recoveries fall off the active list?
When we get to them. when we can catch up. When we catch up, honestly, some of this is so secondary to needing to keep up with the new cases and trying to communicate who's at risk, etc. I would think, and I've said this before, our data will all be cleaned up and washed up and nice and neat and tidy a year from now, if we're lucky. Okay. And we're going to see, everyone wants to know about death data and increase the death rates. And all. That stuff comes out a good year beyond the collection of the data. That's how long it takes to really kind of, and remember, because you're collecting this data from multiple sources. There's a lot of duplications. There's just a lot of cleaning up that needs to be done with data before we can consider it finalized. So, it'll happen. I'm sure it'll happen, and we'll get to it as soon as we can, but it's probably going to, it's not one of our priorities, to be honest with you. So I would say, how far behind are we on that stuff? A month, 2 months? I don't know. A while. I don't even want to give it a time frame. I'm sorry. I should have said it'll happen.
All right, the next question is in comments were from Melinda. She kind of had a long statement, but at the very end of her statement, she wondered, because of the cases and everything going on, do we think that, or do we know if the schools are talking about going virtual?
Yeah, you know what? Thank you for this input. All I can say is I need to take this back to the schools, and we'll have some further conversations. I haven't talked to them now for 2 weeks. We missed last week. So I do think that we need to sit down with them and find out what their plans are, what their intentions are, what we can encourage them. Again, a pause is not unreasonable, but remember, there's risks and benefits to all of this, and it may not make a huge difference. A lot of exposures are occurring outside of the school as well. So we just have to kind of think about all of this. We also have the holidays in front of us, and that'll be a natural pause. So that might be some. I remember last year, a lot of the schools were a little bit more open to pausing in alignment with the breaks that were already scheduled, because it's a little easier for everybody. So more to come on that. Maybe next week I can be a little bit more. I can't speak for the schools right now because I haven't talked to them in a while. So we'll get to that.
Okay, Christy asked, do you plan on using schools in the county as vaccine clinics once the green light is given for the administration for the 5 to 11-year-old age group?
We have discussed it, but we do not have any immediate plans to do that. We'd like to focus on having pediatricians and healthcare providers, and also be able to provide these vaccines, by appointment. I think because there's a lot of considerations when you give pediatric vaccines. It's not off the table, but at this point, there's no immediate plans to do it. We've kind of just discussed it, touched it, and kind of set it aside to kind of work on this other approach first. So we'll see if it's something that's highly needed and the demand is great. We'll certainly bring it back to the table.
Okay, this next one is from Beverly, and I don't know how to pronounce one of the words she says, but can a Moderna booster cause a slight rosacea?
Rosacea flare.
Rosacea flare.
Rosacea is a
Thank you.
skin condition thought to be caused primarily by a bacterial infection. So I wouldn't think that a vaccine would be associated with that, although there might be some immune response to that as well. I have not seen that in the literature. It's not impossible, and I would just say I would have to go back and check with our VAERS and our surveillance data system to see if it's been reported. But I have not seen that reported in really any kind of skin condition in any of the literature or any of the VAERS data reviews for adverse events.
Okay, just looking for next questions. Regina said, thank you for explaining the booster versus the third dose. Laura said, thank you for all you
Common,
do.
common misunderstanding. Even our doctors interchange that, and it is important because, as I mentioned, the booster dose is different than the third dose. So it is important, I think, that we get that straight.
Okay, Rachel said, what about just adding a fall break? Um, Mike asked, will you be setting this up at the Civic Center again? That's where we got our vaccinations at.
So I don't. So when we started those large vaccination clinics, remember this huge demand for vaccine. Everyone was like, we had remember thousands of people that were scheduling every day to get vaccinated. We don't have that kind of demand. I don't expect we'll have that kind of demand even for the pediatric formulation. So no, to answer your question directly, we don't have any current plans to have any kind of large vaccination clinic. Going back to the earlier question, if there seems to be a need or a demand to have things school based, we could like focus on doing something like that. But I doubt very much we'll have any kind of large. And if you look at our vaccination graph, you can see that weekly we're providing thousands of booster vaccines a week. So it's getting done without really having the. And remember, those vaccine clinics took a tremendous amount of resources for everyone involved. We did nothing else at the health department other than provide those clinics, and we're back to doing all the other work that we do. So it would be problematic to do it, but again, if the need is very clear that it's needed, then we'll reevaluate and readjust.
And there's so many places that do it now, so
Hmm.
much different than a few months
Yeah,
back.
it's a different situation,
Yeah.
definitely.
Okay, Kim asked, are the majority of our active cases coming from the schools and school-age kids?
Do we have an age breakdown? Yeah, we have an age breakdown, and I can tell you that answer in a minute. It's not the majority. But last I saw was about 20 some percent in school age kids. Okay, 20% school age kids, about 25% of young adults, up till 30 some or 40, 35. Okay, and another 20% from 36 to 65. So you can see it's pretty evenly spread out through the community as far as where this virus is spreading. Yeah. Oh, our individuals over 65 are doing less? Less because they're so heavily vaccinated, probably. What is their rate? 10%? 10%. So if you're over 65, you are least impacted as far as getting this. Unfortunately, you're also one of the higher risk if you get infected. But so it's almost like we used to always have people say, "Well, I want you to post that map where you can show me which communities have how many cases." And I keep saying to everybody that is not in any way helpful, because you can't look at a map like that and assume that you don't have risk unless you never leave your home. And then case that's your reduction of risk is right there. But community spread is community spread. It's widespread, and you can't base that on the number of cases that we identify and tally.
All right, Doc, there's no more questions. So if you want to end the show with any closing comments, we can say goodbye till next time.
Happy Halloween, everyone. I can't believe it's the end of October. Let's hope to see a reduction next week in our cases. We can all talk about the holiday season being calm. Please don't disregard the things we know work, right? The vaccine works, social distancing works, masks work. I traveled this weekend. I wore my mask the entire time in the airports. It's amazing. Everyone's wearing a mask, no big deal. But after return, I'm going to play it safe. I'm going to take it easy. I'm not going to in-person meetings, for instance, things like that. So I think everybody needs to just adjust their life according to their risk and according to their exposures. And doing those kinds of simple things can really go a long, long way for protecting everyone. So thank you for everything you do. Thanks for listening in, and we'll talk to you guys next week.